An important health story now because the government's to unveil a plan aimed at improving care for the thousands of people living with ME. The Department of Health and Social Care says it's committed to changing attitudes and will invest in research along with offering access to care in the community. Let's look at the figures because it's thought there are more than 400,000 people in the UK with ME, or chronic fatigue syndrome as it's also known, and thousands more who don't have a diagnosis. The cause of it is unknown, but symptoms can include feeling tired all the time, problems with sleeping and brain fog. So the government is now planning to introduce new training for NHS staff to try to improve awareness about the condition and to reduce the stigma which can sometimes surround it. And as part of the rollout of neighbourhood health services, which we've talked about over the last couple of weeks, they want people to have better access to care closer to home and from specially trained staff. Campaigners say it's a good start, but the pledges don't go far enough.
People have been ignored for decades. People have not had access to basic healthcare services, social care services, the financial support that they need. In the most severe cases, people's lives have been lost as a result of that. And therefore, the government has made a great start, but we need urgently to see actions implemented so that people are not left to suffer any longer.
Well, today's plan to improve care for people with the condition comes after the death of a young woman with the disease. 27-year-old Maeve Boothby O'Neill had been living with the debilitating condition for more than a decade before she died from malnutrition in 2021. We're joined here on the sofa now by Maeve's mum, Sarah Boothby, and respiratory specialist, Dr Binita Kane. Morning to both of you. Thank you so much for coming in. Sarah, first of all, let's start by trying to explain a little bit to people at home why this condition has been so misunderstood and confused for so long.
Thanks very much for asking us on here to talk about this. And it's a year to the day since the full hearings into how Maeve died opened, which took place after 3 years of investigation. And I tried really hard to keep an open mind. Maeve died from natural causes, so there didn't have to be an inquest. But I asked for there to be one so that we could try to make public why ME has been so neglected for so long. So to answer your question, the way Maeve was treated while she was in hospital was she was constantly being referred to psychiatric services because the conception has been that ME is a mental illness. It isn't a mental illness, and Maeve didn't have any mental illnesses. Lots of people do, and it's easy to confuse an illness that doesn't have a diagnostic biomarker with a mental health condition, except that Maeve was of the soundest mind of anybody that you could ever hope to meet. How that confused, well, I think we're here to talk about the plan, and I would like to be more positive about it than I honestly can be. I think we're in this. I woke up at 4 o'clock this morning just thinking, this is mad. I am going to try and talk about something that is mad. And the madness is that we are now reliant on a politician to make a decision about commissioning services for an illness that is killing people. There was another prevention of future death reports issued last week for someone who died from ME. She died by suicide, which is how most people die from ME. Malnutrition is another way people die from ME. And there is nothing that I can see in the plan that is going to prevent more deaths. Nothing.
So sorry for everything you've been through, and the numbers are staggering, aren't there? 400,000 people out there with ME. But for people watching right now who don't have any experience of it within their families or haven't got it themselves, what was your experience? How did ME affect Maeve? What did you see? That's
a great question to ask, and I really thank you for asking. It's a lot more than chronic fatigue. ME it affects every part of the body, and while people talk about it, about relapsing and remitting, the recovery rate from ME is so low, it's hardly measurable. Part of that is because the records are not being kept, which is acknowledged in the plan. There's no records, there's no service, and there's no medical expertise within the NHS. So, for example, when we went to the inquest, we struggled to find an expert witness because this country has driven out all of its medical knowledge and expertise on post-infection diseases. I think that's nuts. It's absolutely nuts. And that responsibility can't lie with a politician who changes. I mean, I can't count the number of ministers and secretaries of state we've had since Maeve died. It's ridiculous that somebody who is not medically qualified or medically trained is going to make a decision about specialist services like ME. It needs a national service. You can't expect local provision to meet what is a relatively small, so while you say 404 is a very large number, and then there are all the people who are not yet diagnosed as well, but out of a population of what, 70-something million, that's not going to be, you're not going to see enough of it locally. You need clinical expertise. So I'm very pleased that you've invited Binita, because she can talk about that very articulate, much more than I can. And I would say on her behalf, and all of the families who are going through what we went through, you can't find anybody within the NHS who knows. So we couldn't get an expert for the inquest, by which time, from my point of view and Maeve's point of view, obviously it was too late, but it's also the situation faced by tens of thousands of families right now, some of whom will be watching this. They can't get a medical expert from within the NHS either. And without an NHS service, where do we go? Where are we supposed to go?
Dr Kane, there's the question. Where do they go? Where do families go? If more localised help is coming, maybe the people locally don't have the knowledge, the experience, the expertise to support families?
So, look, I think thank you, Sarah, for talking about what is such a difficult subject. And I think the plan is a good start. It does talk about, it acknowledges for the first time at a very high level that ME has been neglected, that care isn't good enough, that we need to raise awareness, we need education, and not just in healthcare, but across education, social care, employment, welfare. So it acknowledges a lot of that, and it will make a good start to addressing some of those issues. I can see this plan in 10, 20 years potentially making really meaningful impact to patients. But what it doesn't do right now is change clinical services on the ground. There is no commitment to new NHS services. Critically, there is no commitment to funding for a service for severe ME. That is sitting with the Secretary of State at the moment. So if Maeve was still alive now, this plan doesn't actually mean anything would have changed. And that will be very disappointing to people. And there's long and complex historical reasons why we are in the state that we are in, but it's really important to understand as well that that 400,000 figure is people with ME, but it doesn't include the potentially over 1 million people with long COVID who also would meet the criteria for ME. So I think the scale of this is much bigger than this report actually highlights.
Can you give us a sense of what the need looks like on the ground? What are you seeing in terms of waiting lists and delays and time spent, trying to search for help?
So imagine a condition like asthma or diabetes, which has got mild, moderate, severe, very severe. And some people might do well with community services, with GPs, OTs, physios, dietitians managing their condition. But actually, as the severity increases, people with those conditions have access to hospital services, to clinics. Sometimes you have access to a super specialist service, what we call tertiary services. In ME, none of that exists, and we don't have the clinicians within the NHS, because if you want to practice this medicine, you can't do it within the NHS because there are no commissioned services. So we're in this vicious circle where interested doctors have to practice outside of the NHS. And that forces not only doctors but patients into the private sector, which nobody wants. And most patients can't afford, quite frankly. So it does leave people who are struggling right now, and many tens of thousands, potentially hundreds of thousands of people across the country with this condition. It doesn't leave them better off. And there is no clear roadmap in the plan for how those clinical services are going to be implemented, what the timelines are. So whilst it's a really great start and a lot of work has gone into it, we must acknowledge that, and we thank the government for releasing the plan. Patients and campaigners will feel that this does not go far enough.
And Sarah, What care, what support? I mean, I don't know if there is, is treatment the right word, but what help do people suffering with ME need?
I think they really need expertise within the NHS, because whatever you say about education and health, social care, employment, all of those things rely upon medical expertise to form a judgment. And without that expertise within the NHS, all of the knock-on effects. So, for example, I was accused of fabricating Maeve's symptoms right up to the point in which she died. 2 days before she died, we were subject to safeguarding investigations, not included because I was the person who was regarded to be the problem, and Maeve, as an adult, was regarded as someone who was too feeble to stand up to me, and therefore she was neglecting herself. But she wasn't neglecting herself. She understood the disease better than anybody else that she met, and the information from patients will inform that expertise if they're willing to listen to it. But so long as the NHS and the British medical establishment continue to look at ME as if it's chronic fatigue, which it is, chronic fatigue is part of the picture, they will completely miss the point, as they have been doing, and there will be more deaths, there will be more time wasted on inquests and prevention of future death reports being written, all of which say exactly the same thing. There are no services, there needs to be a service. The service relies upon medical expertise within the NHS, because it's the NHS that leads the way. And so we're reliant on leadership from within the medical profession, not from a politician who is not medically qualified. I absolutely applaud and appreciate all of the effort that went into this plan. I know people worked really hard on it, and thanks to the civil servants for listening to all of us saying the same thing, but we've been saying it for decades.
And for every patient, there is also a family, isn't there? This affects so many people.
Absolutely.
Yeah.
Absolutely. I know families all over the country who are dedicating their lives to the 24-hour care that very severe patients need. The whole point, I would have thought, because the government's aim is to prevent disease, is to make sure that ME doesn't get that bad. And with the proper clinical expertise within the NHS, that advice can be given to everybody, how to manage the condition until we understand better how to treat it or cure it.
OK, we have to leave it there, but thank you both so much for coming in.
Thank you.
Thank you for telling us Maeve's story, and we wish you well, and we'll keep in touch. Thank you.
Thank you.